Welcome to today's talk, Tuesday the 12th of April. Now, I've got some very interesting data from sewage in a minute from the United States, indicating that they can now test for viral particles in sewage. Now, they've been able to do this for a while, but it's been extended and they're able to work out what's going on in the States. And this could be expanded to any virus or bacteria that's excreted by the gastrointestinal or urinary tract. So really quite interesting potential here. I know it's been going on in some other countries, but the American data is interesting. Now, just before we get to that, I just want to show you this really interesting graphic from the UK. Now, this is current, it's today's. Now, this is hospitalizations in the United Kingdom. Now, the key thing here is this is Omicron BA.1. And this is what we might call the BA.2 bounce. And I do believe that this is just starting to level off and go down now. It will hopefully carry on going down. But what we notice is that the BA.2 hump or spike is about the same size as the BA.1 hump or spike. Now, in the United States, I'm not expecting the BA.2 hump or spike to be as profound as this, but it will be heading in this direction to at least to some extent. Now, let me just show you something else here. So that they're the hospitalizations, BA.1 and BA.2. Now, this is intensive care admissions. Now, Omicron came along, around about mid-December here. And so this is the effect of Omicron basically from this year. And we see basically that the cases have gone down ever since Omicron became with us. So going down and down and down with BA.1. Now, this is the BA.2 bounce here. And there is a bit of a bounce, but this is just because there's just so many cases. And some of these are incidental. I've just read a figure actually from the NHS that estimates that 58% of people in hospital with Omicron are admitted with Omicron, not because of Omicron. So get some pretty good ideas of what's going to happen in the States. Now, just before we go on to look at some more data, let me show you this water data here, wastewater data, which is really quite interesting. Here it is here. Now, this is for the total result. So now the solid blue line here is the amount of virus in the sewage, and the clinical cases are in the lighter blue line. And what we see is, if we just zoom in on this latest Omicron wave here, what we see is that the cases in the sewage go up first, and then the cases in the population go up second, or the detection of the virus in the sewage goes up first, and then the detection of the virus in the population goes up second. So we see that it's kind of leading the way, which is quite interesting. If we zoom in a bit, we see that again. So here we see the same thing, the increasing cases in the sewage, and then the increasing cases in the population, or the viral detection in the sewage. And they're actually able to detect the amount of viral particles per mil. Now, these are average for the United States. I think there's about 60 testing stations all over the state. So these are averages. Just before I tell you something else, there we go. So this is the latest. So here we see that what's happened now is that the detection of the virus in the sewage has started to increase. We see that clearly. But the clinical cases have not yet started to increase, or they haven't much. They've actually increased a few percent. So this means this increase in the sewage here, in the virus detected in the sewage, does mean that there's going to be an increase in cases overall in the States. So, but let's I'll just show you some more US graphics just before we get down to some more detail. Here we have the United States. So here's the cases, gone up very slightly in the past few weeks, but just looking at that in the context of the this huge Omicron BA.1 curve there, very profound. This graphic here is actually showing the hospitalizations, which, as we've seen, have carried on going down really quite progressively and quite gratifyingly, and are still going down as we speak. And this final one is the deaths, which, as we see, are still going down quite dramatically from this Omicron peak here. So really quite encouraging data from the States in those terms. Now, let's look at some detail now. So United States, this is the BA.2 surge, which is just starting. Nationally, the increase is about 3% over the past week. about 31,000 cases a day at the moment. Now, there are exceptions to this, places that kind of seem to be leading the way in the States, as has often been the way in the past. New York is sort of leading the charge, as it were, in the States. So higher cases in New York, up 39% in the past 2 weeks, but also higher in Washington. Hospital patients, though, in the States overall down 8.2% in the past week. But we can expect some localised blips. And just while I remember, I was going to tell you that wastewater information, that's available broken down by state all the way down to county level. So if you're in the States, well worth a look at that data. It's really starting to come online now that the use of data is getting much, much better, or the distribution of the data is getting much, much better. So that's the wastewater monitoring programme. Copies of the virus per mil. They're actually using a PCR type technique here to look for the actual viral genome, which is really quite clever. And this is a direct quote from their site. The level of virus in wastewater is the leading indicator, indicating, as we've said, that it happens first. It precedes the change in clinical cases and hospitalizations. So we do know there's going to be an increase based on this data, but not too big at the moment. Now, Philadelphia, for example, they've restated the mask mandate, first major city to do so. Now, this is Cheryl Bettigole, Health Commissioner in Philadelphia. This is our chance to get ahead of the pandemic, she says. Now, what do you think? Do you think she's right? Will you get ahead of the pandemic? Will you get ahead of Omicron BA.2? I'm afraid I don't think so. I really don't think we've got any evidence that wearing masks is significantly going to reduce the spread of BA.2. In Alpha and Delta, yes, I believe there was evidence there. I don't believe the evidence is yet there for the Omicron. Now, it's reasonable to assume there'll be some protection, but the idea that you can halt Omicron. Remember that poster we used to have up, "Stop the spread of COVID-19," and we took it down because you can no longer stop the spread, especially with Omicron BA.2. So this is our chance to get ahead of the pandemic. I wish it was, but I don't think it's true. I'm afraid I'm going to give you a cross on that one. I don't believe it's true. 142 cases per day in Philadelphia, 4,000 in the Omicron wave so far. But we know that many more people have had minimally symptomatic or asymptomatic infection, and we believe that 45% of the whole population of the United States has had Omicron. So obviously in Philadelphia, it's going to be much, there's going to be a lot of people have had Omicron already. So therefore we'll have good levels of immunity. Knowing that every previous wave of the infection has been followed by a wave of hospitalizations and then followed by a wave of deaths, she thinks it's going to be the same again. The health commissioner, then it will be too late for many of our residents. That's why she wants to get ahead of the pandemic. Well, firstly, I don't think you're going to get ahead of the pandemic. And secondly, there will be some increased hospitalizations. There will be some deaths, but it will be way, way less than it has been in the past. Because even though we saw the increases in the UK in hospitalizations, they were way, way less than previous waves. And I believe that a lot more people have had natural exposure to Omicron in the United States because it's been rumbling around the States for longer. At least BA1 Omicron's been rumbling around for longer. They're now entering their BA2 period, which, by the way, the UK is just moving out of. We're just starting to decline now. Now, the Office for National Statistics data from the UK is just out today, but we can't look at that now because we're focusing on the States at the moment. But we'll look at that tomorrow, probably. Now, Dr. Jha is the new White House coordinator for COVID. We've got to watch this very carefully, he says. Well, yes, okay. We'll allow that because you're new, obviously. I don't think this is a moment where we have to be excessively concerned. Well, here, I do agree. I'm not excessively concerned. Right now that it's showing an uptick, it is, but it's not showing substantial changes. It's not indicating substantial changes in what we should be doing. I agree. So if he's saying here, well, if Dr. Jha's saying here, well, okay, we're going to watch it. Okay. I was a bit sarcastic there. I apologise. He is correct. Of course, we have to watch it. But he's not excessively concerned. We agree. It's showing an uptick, yes, but does that mean we should be changing what we're doing? I agree with them. I don't really think it does, because I think we need to take full advantage of the herd immunity that this BA.2 is giving us as we move into endemicity and asymptomatic and minimally symptomatic infection for the vast majority of cases. And that's only going to get better as immunity, as natural immunity, this wonderful natural immunity that our brilliant immune systems give us is become more and more widespread. Isn't the human immune system an amazing thing? That we react to natural viruses and make brilliant immunity to it. Polyclonal immunity, multi-epitope immunity, reacting to many different antigenic proteins on the surface of the virus, generating polyclonal antibodies and polyclonal B and T cell responses. It's just wonderful the way it does that. You know, the immune system, when I was doing my immune module in my biology degree, it was that's a long time ago now. That's probably about ages ago, 25, 30 years ago or something. At that time, they were saying that the immune system could recognize 9 billion different types of antigen. 9 billion. It's probably even more now. Amazing. 9 billion different types of things in the environment that we can make immunity to. Absolutely excellent. Now, Mayor Eric Adams, New York's one of the increasing cases, of course. Now, Mayor Adams has just tested positive, and I'm pretty sure Mayor Adams is diabetic. And this is him speaking at the moment. I feel fine, no fever, no runny nose, no aches or pains. Let's hope it stays that way. Fairly typical, atypical, but well, typical for a minimally symptomatic. Runny nose is the most common feature, but doesn't have one, so that's good. I probably would have a different outcome if I was not vaccinated and boosted. Now, Mr. Adams is in his early 60s, so I agree. Someone with diabetes in their early 60s, we know that diabetes is the biggest comorbidity in deaths in the UK. So I do believe that the vaccine is helping him, but I'm delighted in a way that he's got the infection now because it's going to boost his natural immunity quite dramatically. So as long as he stays well, I would argue that it's good that Mr. Adams has got the infection because it's going to boost his natural immunity while he's still got some immune cover from his vaccines. As long as he stays minimally symptomatic, and so far he is, which is excellent. He says he actually feels fine, despite being early 60s, despite being diabetic. So we'll see if we can keep an eye on that. It depends on what the news tells us, of course. We can only report what we are told. That's not true. I mean, to an extent, we are dependent on mainstream media, but of course, we've got a lot of other sources that we look out now and always try and bypass mainstream media. But of course, that's where I got that particular interesting story from. Now, moving on to China. Well, let me just tell you what I've got for today. Shanghai. China has reported more than 200,000. So this is So China in this wave. I'm talking about Shanghai in a minute, but China first of all. 200,000 locally transmitted cases have been detected. So I can't remember if this is actually. I think this is Shanghai. I think these 200,000 cases are Shanghai. So I think this is Shanghai has reported more than 200,000 locally transmitted cases. I don't think it matters too much actually, because about 90% of the cases in about 95% of the cases in China at the moment are in Shanghai. It's the real epicenter at the moment. So about 200,000 cases detected in Shanghai, locally transmitted, mostly mild or asymptomatic. And the Shanghai authorities say one case is currently categorized as severe. So let me just clarify this, because I'm sharing your incredulity. I know 25 million people locked down, suffering terribly, 200,000 locally transmitted cases, one patient described as severe. One patient described as severe. We don't know how severe. We believe he's hospitalised. Does that merit locking down 25 million people? I mean, it just doesn't make any sense whatsoever. And yet this is still the strategy. No deaths. So one severe case in Shanghai, no deaths, 25 million people locked down. It just doesn't make any sense at all. US State Department, non-emergency US consulate staff have been ordered out of Shanghai. Americans should avoid travelling to China altogether, but why? Why is the US State Department giving this? Because China is subjecting people to arbitrary enforcement of local laws and COVID-19 related restrictions. Arbitrary. Now that to me is saying that the State Department doesn't really see the medical, epidemiological, scientific rationale for what's going on there. And I completely agree. And I've had a lot of emails from China. People are really suffering there. And we looked at one in detail yesterday. 25 million people locked down since the 1st of April. Quite incredible. Some family separations. Now, we believe that children are being separated from parents. Now, if there's children being separated from parents, that can cause severe trauma to both, of course, but to the children especially. That this is not a proportionate reaction. What is going on? It's utterly bizarre what is going on. For one severely ill person who's being managed in hospital anyway, apparently traumatizing presumably thousands of children is acceptable. This really is something very, very strange that's going on in China. Ling Wayne, senior officer, China National Health Commission, says this: we cannot let our guard down. People first, lives first. Lying flat is not an option for China, which I guess that's their way of saying being phlegmatic, laying back and doing nothing. So he's saying we can't let our guard down. The policy that they're carrying out now is people first, lives first. Doing nothing is not an option. One severe case out of 25 million. What the heck is he talking about? Right, over 60s in China. This is. I'm actually going to make his case for him now. Over 60s in China. I did check this. 264 million over 60 in China. 40 million unvaccinated. Why? Why are these 40 million not unvaccinated? I don't think it's lack of publicity. So if they're not vaccinated by now and the vaccines are readily available in China, is it their own fault for not being vaccinated already? You could argue that. This guy, Ling Wayne, does say infections amongst this age group are inevitable. So what's the point in kicking the can down the road? And Guangzhou city, this is the big city just north of Hong Kong. 30 cases there, and as a result of that, they're PCR testing 18 million people. And it's like 25 million people in Shanghai have been PCR tested. And they're doing it all again. The testing capacity is absolutely stunning. But remind ourselves that one person is critically ill in 20 out of 25 million people in Shanghai. Omicron cannot be stopped, even if they excluded it altogether. The first traveller that comes back in, it's gonna be back. And what they're going to do, lock down every time someone travels into the city. Very, very strange. So there we go. Tightening up the prognostications now for the States. There is going to be an increase. We base that on the UK data. We base that on European data. We base that on the US sewage data now as well. But it'll be fairly minimal, and most people in the United States, according to the White House doctor, should just carry on living their lives as normal. I agree, and I would just add, be thankful for natural acquired immunity. Thank you for watching.